After 65, most seniors believe the more health screenings we do, the safer we are. But what if I told you some tests that you've been doing for years may not only be unnecessary, they could actually put you at risk? Yes, it's true. Not every screening is helpful after a certain age. In fact, experts say that overscreening in seniors can cause stress, false alarms, unnecessary procedures, and even harm. But here's the problem. Most doctors never actually tell you when to stop. They just keep recommending the same checkups every year. So in today's video, I'll reveal the Korean 7 health screenings that seniors over 65 should think twice about continuing. Kuri, and the science-backed reasons why. Stay with me till the end because the seventh one is the most surprising of all. Let's start with the most common one, colonoscopy. Up to age 60 or 65, colonoscopies are valuable for detecting colon cancer. But after 65 or 70, the risks begin to outweigh the benefits. Complications like bleeding, infection, or perforation of the intestine become more common. In fact, a study published in JAMA Internal Medicine found that routine colonoscopies in seniors over 75 provided little benefit but carried much higher complication rates. Better approach. Talk with your doctor about switching to less invasive tests like stool exams or fit tests. So if you're past 65 and healthy, colonoscopy may not be something you need every few years. Number 2, Pap smears for cervical cancer. Most women over 65 don't actually need routine Pap smears anymore, especially if they've had a history of normal results. The American Cancer Society recommends stopping Pap smears after 65 for women who've had regular negative tests in the past 10 years. Yet many seniors are still told to continue these tests unnecessarily. The truth is, the chance of cervical cancer at this stage is very low, while the anxiety and cost of repeated tests are not worth it. Third, PSA blood tests for prostate cancer in men. On paper, this sounds like a lifesaver. But here's the reality. PSA tests often give false positives. This creates panic, more testing, and sometimes unnecessary surgeries or radiation treatments. The U.S. Preventive Services Task Force actually advises against routine PSA screening for men over 70. Why? Because the risks of overtreatment outweigh the benefits. If you're symptom-free and healthy, you might not need PSA tests anymore. Instead, focus on regular doctor checkups and reporting any new urinary symptoms. Fourth, heart stress tests and EKGs. Unless you have clear symptoms like chest pain or shortness of breath, annual stress tests often create false alarms. This leads to unnecessary angiograms, medications, or even procedures like stents that may not be needed. According to the American College of Cardiology, routine stress testing in low-risk seniors is not recommended. So if your heart is doing fine and you don't have symptoms, you may not need that treadmill test every year. Number 5, bone density scans for osteoporosis. Bone health is important, but here's the truth. Once you've had 1 or 2 bone scans and your doctor has assessed your risk, repeating it every single year adds little value. The National Osteoporosis Foundation says seniors can often wait 2 to 5 years between scans, not every 12 months. So instead of routine yearly scans, focus on calcium, vitamin D, and safe exercises to keep your bones strong. Number 6, routine blood tests without any symptoms. Many seniors are told to get full panels every few months, but unnecessary blood tests can cause false results, overdiagnosis, and repeated follow-ups. The Choosing Wisely campaign by physicians actually warns against routine lab work in healthy seniors without new symptoms. That doesn't mean avoid blood work entirely, but it does mean only test what's necessary and when your doctor actually suspects something. And finally, number 7, memory and dementia screenings. This one might surprise you. Many seniors are given routine memory tests even without symptoms. But the truth is, these screenings are not always accurate. They can label someone with cognitive decline when in reality, it's just normal aging or stress. The U.S. Preventive Services Task Force states there's not enough evidence to recommend routine dementia screening for everyone. Instead, experts suggest seniors should report real-life symptoms like getting lost in familiar places or forgetting daily tasks before going through formal tests. Because false positives in dementia screening can cause unnecessary fear and depression in seniors. So friends, those were the 7 health screenings that seniors over 65 may not need anymore. Colonoscopies, pap smears, PSA tests, stress ECGs, bone scans, unnecessary blood work, ODRMI, and even routine dementia screenings. Remember, this doesn't mean you should avoid all medical care. It simply means not every test is right for every senior. Sometimes, less testing means better health. Always talk to your doctor before making changes. These guidelines are backed by organizations like the American Cancer Society, American College of Cardiology, and U.S. Preventive Services Task Force. Star. Now, I'd love to hear from you. Which of these surprised you the most? Drop your thoughts in the comments. And if you want more science-based health tips for seniors, hit that subscribe button now. Because after 65, knowledge is power, and your health is your greatest wealth.